So we recently sent out an email about the studies that have come up with vitamin D, and I wanted to share those because they're interesting. Number one, because going to medical school, a lot of my professors said that vitamins don't work, don't use them. And number two, because you still hear it from a lot of the doctors, and they say, you know, don't use vitamins that don't work. But these are some of the studies that have come out, and I'll share it. This was sent in our MailChimp, and if you like, you can prescribe to our channels as well as our mail, so that whenever we send out mails, you get them as well. We have one that says study examines how iron and vitamin D deficiencies affect sleep health and quality in women. So we know that, and they said deficiencies of vitamin D were associated with increased risk of shorter sleep duration. The next study says 4 new risk factors for young onset dementia identified, and vitamin D deficiency is one of them, along with orthostatic hypotension, high C-reactive protein or CRP, and social isolation. So vitamin D and dementia. Vitamin D supplementation. Maintaining sufficient vitamin D levels may help reduce knee osteoarthritis symptoms. So, and this was a 5-year follow-up study, which was pretty amazing. The next one is eating more than a dozen fortified eggs each week does not negatively impact cholesterol levels in older adults, studies suggest. This one basically says fortified eggs contain additional amounts of vitamin D, and so or omega-3 fatty acids, typically through nutrient-enriched hen feed. Then the next one is very interesting. This one was hormone therapy can safely ease early menopause symptoms, and one of the supplements that they actually recommend along with a low-fat diet and calcium is vitamin D supplements. The next one, compared with adults with normal vitamin D levels, adults with vitamin D deficiency may have lower COVID-19 vaccination antibody levels 9 months after a final vaccine dose. So again, this is when COVID started, we all said vitamin D is a major thing that you all need to take, and now the research actually shows that those who have lower vitamin D will have lower antibodies, so requiring more vaccines. We have 2 amazing vitamin Ds, and the reason they're amazing and I love them is because one of them is micellized, the other one is micro-emulsified. And the reason for that is this basically, vitamin D is an oil-based molecule, and when the molecule becomes chopped up really nice, the absorption of it becomes much easier, much faster. And all of my patients are on either of these 2 vitamin Ds, and we see amazing results right away. We see results going from 27 or 30, which is the bottom of the page, to 80s, 90s within 2 or 3 months, using a modest amount of these things. So number one, I recommend vitamin D to everyone because we know 80% of the population is walking around with a low vitamin D. So it's important to increase vitamin D. And remember, vitamin D is very important with immunity. A study of women who had breast cancer showed that their vitamin D was around, higher 20s. So it's good to definitely, all of my female patients, we get them out of 20s and 30s right away and bring them to 70s and 80s, at least, so that at least we make sure that their immune system is good. This is Dr. Hakimi. You can watch these on our YouTube channel, on our Instagram, and please subscribe to our MailChimp so that you can get all this information that come out, and we'll post these on our website as well. So if you want to see the research, you can actually see what the research said.